So with liquid biopsy, we refer to something which we find from the tumor in the blood of a cancer patient. For example, if somebody is affected by cancer, a tumor is growing, the tumor can shed tumor cells in the blood, which we then call circulating tumor cells. Or it can also shed circulating tumor DNA into blood, which we then call circulating tumor DNA. And both of these entities we then can summarize as liquid biopsy, because we can find it in the blood and we can extract it out of the blood. And it contains the same information as, for example, a tumor tissue itself. So if you make the gold standard a tissue biopsy, you also retrieve a part of the tumor and do analysis by a microscope. And liquid biopsy, you take up the blood sample, you try to isolate circulating tumor cells or ctDNA and try to reconstruct, for example, the genome of the tumor by these liquid biopsies. So the advantage is quite simple. So it's a minimal invasive approach, which means you simply take a blood draw. So you take a normal blood draw sample and can then isolate the tumor relevant information. Instead, the tissue biopsy is very invasive and you can't do it all the time. So if you want, for example, to monitor a therapy of a patient who is suffering of cancer, you would have to puncture every time the tumor, which is very invasive. You cannot do that. But with liquid biopsy, taking a blood sample, you can do regularly. So this is the biggest advantage of this procedure. So right now, liquid biopsies are very much lying in the part of research. Nevertheless, several liquid biopsy assays are already approved by regulatories like the Food and Drug Administration in the US, the FDA. So for example, in lung cancer, in patients who are suffering of lung cancer, you can already use liquid biopsies, which means if a patient gets a treatment and you want to monitor if there is a resistance coming up, you can use liquid biopsies. And from a certain time point when the liquid biopsy is giving you a mutation or a signal for mutation, which can be found in blood, then you should change the therapy. If you still fail to retrieve information by liquid biopsy, you still go back to the tissue biopsy. Nevertheless, this is actually one of the already promising approaches which is already translated into the clinic for lung cancer patients. So one of the, let's say, major drawbacks of liquid biopsies is that usually patients need to be in advanced stage that we can find something in blood. So only large tumor masses or patients who are suffering of metastatic disease, there we can find, for example, circulating tumor cells. So in localized disease, so where the tumor is small and not yet very easy to detect, even with imaging, then we don't find much material in the blood. And this is maybe one limitation of liquid biopsies. Of course, we want to go in the way that we can detect liquid biopsy or tumor information by liquid biopsies very early, because then it will be also much easier to treat patients. If you find early, for example, a mutation of a tumor inside the blood sample, the tumor can be localized and you can resect it by surgery. And this is much more effective as if the patient would be already in advanced stage of disease. So at CBmed, we have a very large liquid biopsy focus. And what we try to solve is a big hurdle in liquid biopsy. We try to overcome the quality issue. So there's a big lack of standardization in liquid biopsy, in the liquid biopsy field, which means there's not much data gathered from the time point a sample is acquired at the, for example, hospital bed. The sample is brought to a lab for liquid biopsy analysis. And this is like a black box for the quality of the sample. And there are large consortia which have tried to implement standards for collection of blood sampling and how we should process them. And for example, SPEDIA4P or the Cancer ID Consortium, they came up with SEN and ISO standards. And we at CBmed try to implement these standards that we have the best quality of the blood samples. So this is one of the biggest part of the project. But we also have developed another approach. So we are not just looking at, for example, circulating tumor cells or circulating tumor DNA. We go in CBmed with a multi-analyte approach. So we always analyze circulating tumor cells, circulating tumor DNA, and other particles which we find in blood to have a broader overview of the patient status. So one big advantage or one possible contribution to the bigger field is that we really try to implement these standards, so the standardizer standards. So we really want to give quality to a sample. So when you know what the blood sample has gone through, you also trust the results you produce. So that's one of the biggest advantages I think we can deliver in our project. Another contribution would be our multi-analyte approach. So we really think of not just one entity when we look at liquid biopsy. We really want to have all biological materials we can get out of blood to be analyzed. Circulating tumor cells, circulating tumor DNA, but also circulating RNA, which we also were able to retrieve from our cancer patients. And that's maybe the biggest advantage to go in a multi-analyte approach. So general liquid biopsy is something which will be becoming a part in the clinical routine. So what we are doing is we include liquid biopsy now in every cancer project. So it doesn't matter if it's, for example, our drug screening project, it will be there a pillow included with liquid biopsy. Why is it included? Because liquid biopsies give us information add on to the normal clinical data, add on to the drug screening data, for example. So that's what we are going to do. We include additional information. Furthermore, we developed an in situ approach which allows to analyze the RNA of, for example, circulating tumor cells. And this approach will be further developed because we see a lot of benefits using that technology instead of, for example, using antibody staining. So that's the way we're going. So we further develop the assays and we include liquid biopsy in every cancer project.